And everyone, I just put the record button on. We're recording this because we may end up posting it on our Medical City YouTube page later on, just so that more patients and families and et cetera may be able to be reached by this. So everything will be kept confidential, of course, but just wanted to let you guys know that. But anyways, hello, welcome to the Be Empowered Education Series. My name is Aubrey Merrill. I am our oncology coordinator here at the Sarah Cannon Cancer Hospital at Medical City Plano. I'm excited to introduce our speaker today. Her name is Lisa Ayala. She has worked as a physical therapist for over 20 years, and she's been at Medical City Plano for the last 16 years. She is certified in manual lymphatic drainage and has been through oncology-specific rehabilitation training. Lisa's prepared a very informative seminar for you today. If you have any questions, there is a chat box. If you go ahead and put those questions in there, I'll be monitoring throughout her education, and I'll interrupt her if it's a good question to ask during the presentation, or at the end, I'll save those questions and ask her at the end. If you need any tech support or anything, feel free to message me or text me, whatever you need to do. But with that, I'm going to turn it over to Lisa. Thank you, and enjoy today's presentation.
Hello, good afternoon. As Aubrey said, my name is Lisa Ayala, and I work here in the outpatient PT department. I first became interested in learning more about lymphedema about 20 years ago, after my dad was diagnosed with lung cancer. I wanted to be informed during his treatments and part of his recovery. I have been passionate about helping oncology patients through their recovery since that time. The purpose of my presentation is to inform you of the benefits of exercise and how it can help decrease the physical issues caused by cancer treatments. Patients usually complain of pain, fatigue, deconditioning, including decreased muscle strength and endurance, difficulty walking, difficulty swallowing, balance issues, and chemo-induced peripheral neuropathy. According to a Danish study performed in 2011, out of all of these physical issues listed, the most reported is fatigue, dyspnea or trouble breathing, muscle pain, and neuropathy. Chemotherapy is a systemic treatment that uses drugs to travel through the body and kill fast-growing cells, cancer cells that have spread to various parts of the body. This makes chemotherapy different from surgical intervention and radiation therapy, which targets a specific area in the body. Radiation therapy targets a small area to kill cancer cells and decrease the size of tumors by damaging the DNA. So these therapies can cause such issues as hair loss, appetite changes, nausea, and again with the fatigue, pain, neuropathy, and fluid retention. Incidence of fatigue. Fatigue is defined by the Oncology Nursing Society as a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with usual function. Quite a mouthful. But basically, fatigue is subjective. It's reported by 80 to 100% of cancer patients, and is very important for patients to report fatigue to their doctor. It can affect a patient's physical, emotional, and cognitive state. According to Dr. Ann May, cancer-related fatigue is one of the most distressing side effects of treatment and can persist for many years after treatment ends. But be encouraged, because the University Medical Center in Utrecht, Netherlands performed a study that showed an 18-week supervised exercise program had a positive impact on fatigue and physical fitness for patients with stage 1 through stage 3 colon and breast cancer. Chemo-induced peripheral neuropathy is reported by 50 to 60% of cancer patients. Damage to the peripheral nerves caused by chemotherapy in a patient's fingers and toes can increase sensitivity to touch or cause decreased sensation, which can cause difficulty with fine motor skills and difficulty walking. The decreased sensation, numbness, or tingling that is described in a patient's feet can make it difficult for them to feel the surface beneath them while walking, causing an increase in falls. So according to a study performed in Heidelberg in 2016, after chemotherapy, exercise is shown to have a positive effect on certain aspects of chemo-induced peripheral neuropathy. Those aspects are the deep sensitivity, the perception of hot and cold, and static balance performance. So standing balance versus dynamic balance. Chemotherapy can cause generalized edema, usually affecting both lower extremities, but surgery and radiation therapy increases your risk of lymphedema in the treated arm or leg. As you can see here, the left arm is bigger than the right. And when lymph nodes are removed from the armpit or the groin area, the lymphatic system is compromised, affecting one of your arms or legs. Post-mastectomy lymphedema can occur following surgical removal of the lymph nodes in the axilla or the armpit, or following radiation therapy to that area. I like to compare the lymphatic system to highway traffic. When lymph nodes are removed or vessels are destroyed by radiation, it's like a 5-lane highway decreasing to 2 lanes, causing the cars to back up on the highway. So because the lymph nodes and vessels are compromised, the fluid is unable to travel as fast and gets backed up into the arms, into your arm or leg, causing the edema. Along with specialized decongestive therapy treatment to decrease the lymphedema, exercise can increase lymphatic flow, which can help decrease the lymphedema or the edema in your arm or leg. Diuretics are often prescribed for lymphedema, but they usually are better for generalized edema because they are used to help the kidneys get rid of extra water and salt from the body. So it helps to decrease general edema, but it's not useful in lymphedema. So how exercise helps. According to an article on cancer.net, exercise is an important part of your cancer treatment plan. A growing amount of research shows that regular exercise can greatly improve physical and mental health during every phase of treatment. Even if you were not active before the cancer diagnosis, an exercise program that meets your unique needs can help you get moving safely and successfully. Always talk to your doctor before you start an exercise program, which should typically include breathing exercises to increase oxygen intake and increase endurance, aerobic or cardio exercise to strengthen the heart and lungs to help decrease fatigue, Balance exercise to decrease risk for falls. Strength training to increase muscle mass, increase endurance, and decrease fatigue. So if done correctly, exercise can help decrease physical side effects such as the fatigue, neuropathy, lymphedema, osteoporosis. Exercising your muscles helps to increase blood flow and improve healing, decrease depression and anxiety, improve balance, and decrease risk for falls. Helps to increase muscle mass, build strength, improve sleep. Helps to decrease the amount of time you need to stay in the hospital if you have to be admitted for your diagnosis. Helps to manage weight. Makes cancer treatments more effective at destroying tumor cells. Improves survival rates for certain cancers such as breast cancer and colorectal cancer. Helps to reduce the risk of other cancers and prevent other chronic diseases such as heart disease and diabetes. So overall, exercise can help improve quality of life. If a patient is unable to participate in an exercise program due to pain, fatigue that interferes with function, balance issues, falls, or an inability to return to previous activity levels, then they may need cancer rehabilitation. Cancer rehabilitation is a comprehensive treatment program, usually consisting of physical therapy, occupational therapy, and speech therapy. They address specific health and movement issues caused by the fatigue, pain, chemo-induced peripheral neuropathy, and decreased functional mobility. For patients who are having difficulty returning to their previous level of function, they live alone, they're unable to drive, inpatient rehab is available. Patients usually stay 1 to 2 weeks, depending on their disability, and they have 3 hours of therapy a day. For patients who have specific health issues and are able to attend a clinic, outpatient rehabilitation is available. Patients usually participate with needed therapies such as physical therapy, occupational therapy, speech therapy, about 2 to 3 times a week. And the treatment usually lasts about 45 minutes to 60 minutes per discipline, depending on their activity tolerance. So potentially a patient could be at the clinic for 2 to 3 hours, depending on how many disciplines they need to participate in to improve their functional mobility. Physical therapy. What is physical therapy? Physical therapists help increase overall functional mobility by comprising an exercise treatment program that consists of strengthening exercises, aerobic exercises, and balance exercises to increase muscle mass, increase endurance, decrease fatigue, and decrease risk for falls. The physical therapist also works with the patient to address their personal goals, develop a home exercise program, and help the patient gain strength to participate in a community exercise program. Here at Medical City Plano, we have an inpatient and an outpatient rehabilitation department. They're both located in Building D. We have therapists certified in manual lymphatic drainage to address the post-mastectomy lymphedema and the lower extremity edema. A therapist certified in pelvic health to address pelvic pain, incontinence, and muscle weakness that could possibly be caused by radiation therapy to the groin or abdomen area. We have a therapist certified in dry needling to address muscle pain and tightness, a therapist certified in vestibular rehab to address vertigo and balance issues. The dry needling is very similar to acupuncture, but it targets muscle spasms, and scar tissue. Scar tissue that could possibly be caused by the radiation therapy. Occupational therapy. Occupational therapy is not about finding an occupation, what most people think. Occupational therapists help patients improve their ability to manage daily activities like dressing, bathing, preparing meals. They help develop cognitive strategies to improve memory deficits, possibly caused by chemo brain, and educate patients on how to improve overall health. Occupational therapy also works with patients to address their personal goals in order to function independently. And here at Medical City Plano, we have 2 occupational therapists in the outpatient department that are certified in manual lymphatic drainage for post-mastectomy lymphedema management. And occupational therapy is also available in the inpatient rehabilitation department as well. Speech therapy. Speech therapists help patients improve focus, concentration, attention, memory, and organizational skills that may need addressing following chemotherapy treatment. Speech therapists also treat those patients with head and neck cancer that suffer from edema and difficulty swallowing after surgery or radiation therapy to that area. Speech therapy is available in the inpatient and outpatient rehab departments as well. Unfortunately, 1.6 million people will be diagnosed with cancer this year. 65 to 90% of those people will be affected by quality of life limiting disabilities related to the cancer or cancer treatment. But only 5% of these survivors will receive oncology rehab. One of the significant barriers is that patients tend to not report their symptoms to their physician. Patients wrongly assume that their fatigue symptoms will not last after chemotherapy is complete, and usually assume that the physician is not able to help them with sleep or fatigue issues. They think it's a common thing. Cancer-specific rehab can help increase overall exercise and activity tolerance, which will increase blood flow and healing. And this will help increase energy, reduce the fatigue, decrease the effects of the chemo-induced peripheral neuropathy, and decrease edema. So each discipline concentrates on various health issues. Physical therapists concentrate on core strengthening, lower extremity strengthening, endurance training, balance exercises to improve overall activity tolerance, and promote safety in their home and community. Occupational therapists concentrate on upper extremity strengthening and endurance exercises. They promote energy conservation and improve performance of activities of daily living in order to promote independence. Speech therapy concentrates on addressing difficulty with speech, their volume, their pitch, cognitive issues, and swallowing difficulties in order to improve their comprehension and overall nutrition. So the Center of Disease Control recommends 150 minutes per week of moderate intense exercise for adults, or 75 minutes of vigorous intense exercise and 2 full days of body strength training each week. Sounds like a lot. That's about 40 minutes of exercise 4 times a week, or 20 minutes of exercise 7 times a week. Research continues to support the health benefits of exercise. We just have to get people to do it. So I sound like that Nike commercial, just do it. So along with the healthcare provider, community resources, and cancer rehabilitation, I hope patients are able to increase their activity and achieve their functional goals. So there are lots of community resources in this area in Plano, the cancer support community of North Texas. There are a few locations, but the closest here is next to the Presbyterian Hospital of Plano. It's a great resource for cancer survivors. They offer a calendar of virtual and in-person events and exercise classes to get people moving and involved in the community. For those cancer survivors looking for a local exercise program, the YMCA has a 12-week program designed to help cancer survivors stay physically active. It's called the Live Strong Fitness Program. And I was really excited to hear that it's free with an oncology referral. And the Plano and the Frisco YMCA both have those programs available. And of course, the Recreation Center in Plano, they have several locations. They have a senior center. They have several locations that have pools, so they offer a variety of land and aquatic exercise classes. And of course, for those cancer survivors in need of cancer-specific rehab, Medical City Plano offers an inpatient and outpatient rehabilitation program located in Building D. Here are my references, and thank you for your time. I appreciate you being here. No, it's more of an outpatient service, so it wouldn't be an acute care service. But yeah, I don't even think in rehab, in an inpatient setting, it's usually outpatient. We usually try to start out with TheraBand. So really, there are different levels of TheraBand that the colors mean easy to hard. So we start out with some kind of a warm-up machine, new step or bike, and then work on, usually initially the very first visit, we talk about core stabilization exercises. So that's the first thing we try to incorporate in the program and get the person really strong in their core, and then work on increasing their exercise with TheraBand. And then eventually, once they get stronger and their activity tolerance is better, because usually in the beginning, they can't tolerate more than like 40 to 45 minutes. And we try to work up to that hour. And fortunately, we have access to the cardiac rehab gym. So we have access to the circuit weights. So that's kind of our goal, is to get them to the point where they can do the circuit weights. And then at that point, we try to go over and help them develop an exercise program that they can do in the community at the recreation center or at the YMCA, or get involved in any of those programs.
And we'll just wait one more minute to see if there's anyone else with any questions. While we're waiting I want to give everyone a heads up. I will send what's called a Survey Monkey. It's just a link to do a survey after this presentation today, just to give us some feedback on what you thought about the presentation and ideas for future topics. So you'll see that in your email, and if you have a few minutes of your time, we'd really appreciate it if you could fill that out. We'll hang on the line for just another minute or two. Oh, here we go. Hang on one second. Let me move the question.
Hi, Aubrey.
Yes.
Hi, this is Marion Nevels. I had both breasts removed. No chemo or radiation was required. The only thing I have a problem with, not a problem, but it's you have the bumpiness under the arm, and I've been doing my exercises. I went to my OT at Medical City, which she did say no, I didn't have any lymphedema. She looked at the back and looked at my arms, and she recommended travel. I used the sleeve, the swell spots, and also the gloves.
Yes.
And how long does the bumpiness under the arm, where you have the nodes removed, that gets kind of irritable? And I do my exercises. Sometimes the fluid moves, and then sometimes it's a little bit more. So
How long has it been?
February.
February. Well, yeah, that's not too long.
Okay.
Well, and unfortunately, once your lymph nodes are removed, it's something that you have to manage. So keep doing your compression and keep doing the exercise, and it'll continue to heal. And if you just want to be aware, keep, looking at yourself in the mirror and comparing your.
I'm sorry, I couldn't hear you. It's kind of getting.
I was just saying, to continue to wear your compression, continue doing your exercises. But if you notice at all that one arm is getting bigger than the other, you can look in the mirror or look at your arm side by side to see if you've noticed any changes. Then I would seek treatment with your occupational therapist.
I know that the arms are not any bigger. I just noticed right at that under the armpit. Right there. Sometimes it's just a little bit puffier, but the arms are not any larger. I don't have any issues with those. It's just that under the arm, it gets a little rocky. Yeah.
Did she teach you any self massage?
Yes, I have the gloves and I have the lotion, that I use too. Yeah, so I do the self massage, and I notice one side. Yeah, so other than that, I'm doing pretty good. I've traveled twice,
Well, good.
since the surgery, and I just wanted to make a comment. Anybody who's going to travel, please use the compression. Use your sleeve and the gloves, and you can also get the one that smooths out the wrinkles. It's just the travel time. You have to remember, you wear the sleeve the length of time of the flight, and once the flight is ended, you wear those sleeves that length of the time after the flight has landed.
Yes.
And it does help. It does help.
Well, good. Good.
But I enjoyed your presentation. It was great.
Oh, good. I'm glad you enjoyed it. Thank you. Well, not necessarily. Pretty much once you have it, it's something that has to be managed. It's a lifetime. It's not something that can be cured. So that is why it's so important to make sure that it is caught early, because most people think, oh, it's going to go away, I'll be fine, but then it ends up getting bigger and bigger. And then what happens if it's not treated, the tissues get really hard. It's called fibrosis, and then that's even harder to treat. That's harder to get rid of. So if it's caught early, it can be managed well with compression, like Ms. Nevels was talking about, wearing the compression and doing the self-massage and exercising.
And there was another question. Does Medical City Arlington have the Live Strong program? Do you know?
This is a community program. It's at the YMCA is the only place that I've heard it offered at. So I'm not quite sure. I just found it on cancer.net. It was a really good resource about exercise and cancer, and it had information on that program. So definitely look it up in your area because they might have it at the YMCA in Arlington.
More questions or comments?
I have one more question. Now you mentioned that you can get in the aquatic pool.
Yes.
How long should you wait after you have that mastectomy before you can get in the pool? Because most of the pools are treated with chlorine.
Yes. I would ask your doctor, but most of the time after all of your wounds are healed, it's usually okay. The hydrostatic pressure in the water is a form of compression. So that's why water exercise is so good for lymphedema. And it takes the pressure off and it's soothing. You know, just make sure that you take a shower, wash the chlorine off, and put lotion on your skin afterwards, and you should be okay. But it really is good exercise for lymphedema.
Okay, great. Thank you.
Any other? If you have any more questions or concerns, when I send out that Survey Monkey for follow-up, feel free to email me back and I can always get your questions sent over to Lisa and get answers back to you. Again, thank you so much for joining us today. We had a really great discussion and really appreciate the questions and feedback. And I hope you join us again next month. Next month, we're going to have a speaker talking about palliative care. So more details to come. Thank you. Have a great day. Bye.
Thank you, ladies. Bye-bye. Have a good week.
Yeah.